Researchers have found a rise in rates of sudden infant death syndrome known as SIDS for the first time in 5 years. The increase in infant deaths hitting Black families the hardest. Tonight we have Dr. Annette Ansong, Medical Director of Outpatient Cardiology at Children's National Hospital tonight. Doctor, thanks so much for being here.
Thank you so much for having me, Ms. Reggie.
So this is such a scary thing for parents. I remember as a first-time parent, my first year, you're terrified when you put your baby to sleep, that the baby doesn't roll over, that, you know, they're breathing okay. Kind of first of all, break down what is SIDS, how does it come about?
Yes, no, as a mom, I completely understand. So SIDS stands for Sudden Infant Death Syndrome, or crib death. And the definition of it is an infant death that occurs in babies less than a year of age. And it's one of the leading causes of infant mortality here in the United States, affecting 1 out of 1,000 babies a year. And the cause of SIDS is not known, but it's speculated that perhaps it may have to do with abnormalities in the brain that affect the way babies breathe and how they wake up. So that's the nut and bolts of what SIDS is.
So why do you think we're seeing this discrepancy when it comes to the racial disparities with the Black community? Why are Black families getting hit the hardest with SIDS? Is it really access to information and education about SIDS?
I think it has. So the particular, so CDC, recently conducted a study where they looked at the rate of unexpected infant deaths from 2015 to 2020. And in that particular last year, 2019 to 2020, they found that Black infants had the highest rate of infant death, 3 times that of white infants. And if you remember in 2019, 2020, that was at the beginning of the COVID-19 pandemic. Now, they couldn't conclusively say that the pandemic had anything to do with it. But one can only imagine that with the COVID-19 pandemic hitting the Black community, the hardest, that this was a factor. Perhaps parents were afraid to go to the doctor's appointments, their pediatrician appointments, and thus they weren't counseled on good ways of putting their babies to sleep, because these deaths happen, when babies are asleep.
Yeah, it's unfortunate. I mean, gosh, those couple of years, the pandemic really touched on so many facets of life. As parents are watching this, they might have newborns right now in the home. What good information can you give us? Some tips that parents should look out for that could prevent SIDS?
Oh, absolutely. I think one of the best things that happened in battling SIDS was the Back to Sleep campaign that happened in the 1990s, which promoted the fact that babies, when put to rest, should be on their backs. And that drastically reduced the rates of SIDS. And then this switched to the Safe to Sleep campaign, because the rate of SIDS went down, but there were other sleep-related deaths. And it helped promote the fact that we shouldn't have loose bedding in cribs. Babies should be sleeping by themselves. So these are all things that parents should know, shouldn't be smoking around the babies. And I think the biggest thing of all, making sure that you're meeting those pediatric appointments, meeting with your pediatrician to get the counseling that you need on how best to protect our babies.
Really quickly, how important is swaddling? Does swaddling help with prevention of SIDS? Because I know a lot of parents say, my child doesn't like to be swaddled.
I think the data is still out there, but I think the biggest thing to do is, make sure that the swaddling is not in any way compromising the way the baby breathes. That if the baby's swaddled and put to bed, that you're, keeping an eye on them. I mean, really, babies shouldn't have any type of loose bedding around them when they are put to sleep. So those are things to know.
Yeah, and the rate, if they can flip over. I mean, there's so much information that parents kind of get all at once, especially new parents. So it's a lot to take in, but this is very good information. And hopefully we can educate our communities more so there'll be less of these deaths. Dr. Annette Ansong, thank you so much for joining us tonight.
Thank you for having me.